I'm Veni Kandasamy. I'm a fellow at the Health Resources and Services Administration's Maternal and Child Health Bureau. I'm excited to talk today about my paper about flourishing in school-age children in the Journal of Developmental and Behavioral Pediatrics. Flourishing is a really interesting concept. It's also been called positive mental health and positive well-being because it's this idea that a person's really feeling a lot of positive emotion towards life and they're functioning really well physically, mentally, and socially. And this is a shift in thinking. We're generally taught to think, mental illness or they're not sick, so they must be well, but flourishing is taking it one step further. Our data is from HRSA's National Survey of Children's Health, the 2012 version. It has a lot of great indicators about child health, but also a lot of the environmental factors that impact health. And so we looked at flourishing as curiosity about learning, resilience, does your child really stay calm when faced with a challenge, and self-regulation, so do they really do what they say they're going to do. What we found was about 48% of children were considered to be flourishing based on the definition in the survey. We also found out that we knew that there would be some differences by like family income, parent education, race, etc. in terms of whether or not your child would be flourishing like from the get-go. But we also looked at things like physical activity, adequate sleep, eating meals with your family to see if those factors, if you control for them, if that would change the likelihood of flourishing based on, some of those differences. So like, even if your family isn't making a lot of money or if your parents aren't as well educated, can you still flourish if you have these other factors in your life? And we kind of found out that you probably can. And so what we found out is those differences by poverty and parent education and family structure really go down quite a bit when you look at all of these other factors that go into it. I think this study is really important because as a field in public health and medicine, I really think we're starting to move away from the illness model and starting to think about what health means holistically. And I think flourishing is a huge part of that. I think that knowing that a child is doing really well and not just not sick is important, right? And that's something that requires a lot more study, a lot more understanding to not only figure out how to measure it and how to accurately capture it, but also how to encourage it in all sorts of settings, in the home, in the school. Start thinking about what are next steps, how can we intervene, how can we make sure that children are flourishing moving forward.